This was me just before my bariatric surgery. Even though I work at Park Nicollet, I had lots of questions and concerns about my surgery then.
Hi, I'm Barb Johnson. I'm a bariatric nurse clinician with the Park Nicollet Bariatric Surgery Center. Even though it has been a struggle at times and I'm learning how to use my tool, I have met my weight loss goals. Adjustable gastric banding provides a lifelong tool for dealing with severe obesity, but it is not a miracle cure. It does require dedication and a strong personal commitment. You need to understand the problems and changes that can come up. The band doesn't do the work for you. You have to work with it for success. You'll probably experience some frustrations along the way, like I did, but as you lose weight, I think you'll feel a pride and accomplishment that will make it all worthwhile. After bariatric surgery, I noticed several lifestyle improvements. For example, I'm now more active and comfortable in my own body. I have more control in my life. I can walk down the street or up the stairs without sweating from exertion. I have energy to play. This video, along with this handbook, contains the information you'll need to make your surgery a success to help achieve your weight loss goal and prevent complications. If you have questions or need additional information, call our bariatric team or visit our website. The bariatric team at Park Nicollet Health Services is committed to providing excellent care for the disease of severe obesity. Let's get started. We'll be showing you the steps you'll be going through by watching one of our patients.
First, it's important that you prepare for surgery. If you smoke, stop smoking at least 4 weeks before your surgery. Smokers may develop pneumonia or other lung problems during their recovery. Nicotine alters your metabolism, and if you try to quit after surgery, you may have difficulty maintaining all of your weight loss. Take time to take 3 to 5 deep breaths or blow up a balloon several times throughout the day. Activity is one of the cornerstones of health. If you haven't been physically active in the past, now is the time to start. If you are currently engaged in regular activity, keep it up. Think about what your activity plan will be following surgery. What do you like to do? Are there friends or family you can exercise with? Would you like to join a gym? Start regular exercise now if you're physically able. Begin drinking 6 to 8 glasses of non-carbonated, calorie-free liquids every day. Begin taking a multivitamin or mineral supplement, and begin to identify protein sources and increase your daily protein intake. Focus on eating 3 meals a day and limit snacking. Read and reread all the information you have about gastric banding and attend support group meetings. It has been found that patients who are compliant with their long-term follow-up and participate in support group meetings have better long-term outcome. Visit our website for links to available support groups. Before surgery, you will need to schedule a pre-surgery physical with your primary health care provider in addition to your visit at the surgeon today. Begin a high-protein liquid diet. This plan will help prepare your body for surgery. It will help to reduce the amount of fat cells in your liver and make it easier for the surgeon to perform your procedure. Your dietitian will review the diet during your consultation. Read through the pre-admitting procedure in your scheduling booklet. Gather items to bring to the hospital. You'll need a list of all your medications, including over-the-counter medications or herbal supplements, your dosages, and the times you take them. Do not bring your medications. Your doctor will order what you need at the hospital. Bring a list of allergies or reactions to medications, food, and environment. A case for your glasses or contact lenses, your insurance card, supportive shoes for walking while you're in the hospital, loose clothing to wear home, toothbrush and paste, mouthwash, deodorant, brush or comb, books and or magazines, and lip balm. Do not eat or drink after midnight on the day of your surgery. Your stomach should be empty to reduce the risk of vomiting during surgery. Vomiting during surgery can lead to pneumonia. After you register at the first floor admissions area at Methodist Hospital, you will be escorted to the preoperative area. Here, your personal information will be reviewed. A nurse will take your blood pressure, temperature, and pulse, and review your medical history. You'll sign a consent form for authorizing your surgeon to perform the procedure. Some blood work may be done. The anesthesiologist, a physician who gives medication to make you sleep, will meet you and discuss the kind of medication that will be used during surgery. Then your IV will be started. A needle is inserted into your vein. In the operating room, medication is given through an IV to make you sleep.
Once you're asleep, a tube will be placed into your throat to keep your airway open. This tube will be removed before you wake up. You may experience some throat irritation for several days after surgery, but most people are never aware of the tube.
Your blood pressure, pulse, and breathing are monitored very carefully throughout the procedure, which will take about 1.5 to 2 hours. When surgery is finished, you will be taken to the recovery room. Nurses will continue to monitor your blood pressure, temperature, and pulse. Your surgeon will speak to your family. You'll be moved to your room when the nurse determines that you are ready. Every effort will be made to give you a private room, but it's not always possible. Your bed, wheelchair, and other equipment will be properly sized for comfort. Assist devices will be available to help you get out of bed if you need them. Visitors are allowed any time of the day, but we encourage them to visit between 9 a.m. and 9 p.m. Your family is encouraged to be with you and participate in your care, but keep in mind you will need to get plenty of rest. A chaplain is available on site to provide spiritual services. In your room, nurses will monitor your blood pressure, temperature, pulse, and incision. They will help you feel as comfortable as possible. You'll feel some pain and discomfort after surgery. Controlling pain is important to your recovery because it allows you to move around. When pain is well controlled, recovery is usually faster, so don't feel bad about asking for pain medications. You'll be asked to rate your pain on a scale of 1 to 10, with 10 being your worst pain. Your doctor will order pain medication to lessen your discomfort. Pain may increase when you get up and out of bed, walk, or do breathing exercises, so make sure your pain is under control before doing these activities. Respiratory problems like pneumonia can occur after surgery. When you lie in bed for a long time or have pain, you may take shallow breaths, but you need to inhale deeply to open up your lungs. You will be given an incentive spirometer. This device will help you measure your breathing and make sure you are taking deep breaths. You should cough after using your incentive spirometer, holding a pillow against your incision to ease discomfort. To avoid respiratory problems, you will be instructed to breathe deeply and cough every hour. Use your incentive spirometer to help keep your lungs clear. Change your position every 2 hours and begin walking the day of your surgery. Because you're lying down most of your surgery day, decreased activity can increase your risk of developing blood clots in your legs. Blood clots are dangerous because they can break loose and travel through your veins to other parts of your body, blocking blood flow to vital organs, causing serious problems. Intermittent compression boots are positioned on your lower legs during the operation to support your circulation. During your hospital stay, you will receive an injectable medication called heparin or Lovenox. This medication will decrease the risk of forming a blood clot. You'll need to walk regularly in the hospital to prevent blood clots. You may also be asked to exercise your ankles to improve circulation. Medications can be used to reduce any nausea you may experience. Let your nurse know if this symptom occurs. You'll have an IV in your arm to give fluids, pain medications, and antibiotics. Once you're able to tolerate clear liquids, the IV will be removed. To ensure that your adjustable gastric band is in the appropriate position, you'll undergo an X-ray examination the morning after surgery. You will be transported to radiology by wheelchair. Once you arrive at the radiology department, you'll be asked to drink a liquid dye, and the radiologist will reassess the flow of the dye through your band using an X-ray device. Once the procedure is complete, you will be transported back to your room. Your diet in the hospital will be clear liquids only. A registered dietitian will see you to review your special dietary needs following surgery. You will start walking the day of your surgery, increasing the distance as your strength improves. Walking helps speed recovery by reducing the risk of blood clots, promoting the return of bowel function, and improving lung function. You'll need to walk multiple times a day. You may need assistance with walking until you're comfortable walking alone. You'll not take baths in the hospital, but you may shower or have sponge baths. You'll be encouraged to do as much of this as possible yourself. If you need assistance, the nursing staff will help you. If you have a catheter in your bladder, it will be removed 1 to 2 days after your surgery. Don't be surprised if your urine is reddish colored. That's very common. Nurses will measure your urine output. Bowel function may return slowly. Your first bowel movements may be loose and dark and will continue to be looser than normal until you are eating regular foods. Your nurses will listen for bowel sounds, ask you questions about bowel movements and gas, and may collect specimens. It can be a little embarrassing, but this information helps nurses assess your progress. Most adjustable gastric banding patients go home the day of surgery or the day after surgery. If an open incision was required to place your band, your hospital stay may be extended. Your surgeon will decide when you can go home. You will need to be able to get up and walk short distances, tolerate drinking adequate fluids, and manage your pain by liquid pain medication. As part of discharge planning, what you'll need at home will be assessed. If you'll need help at home, community and hospital resources are available to ease your transition. If you live alone, you may want someone to stay with you for a day or two.
Give yourself time to recover after surgery. Don't be afraid to ask for help if you need. In addition to the specific instructions you receive from your surgeon, use the following guidelines. Increase activity after surgery as you can tolerate it. If your procedure was laparoscopic, lift as you feel comfortable. Your surgeon will give you specific lifting instructions. You may begin driving again when you are no longer taking narcotic pain medications and feel capable of applying the necessary brake pressure to stop your car. You'll be sent home with liquid pain medication that you can take every 4 to 6 hours as needed. You may also use liquid Tylenol as directed. Keep in mind that the narcotic liquid pain medication will also contain Tylenol, so don't take these two medications together. You may alternate if needed. For example, if you take Tylenol at noon, wait 4 to 6 hours before taking Tylenol again or the liquid narcotic pain medication. Do not exceed 4,000 milligrams of Tylenol in a 24-hour period. We ask that you avoid ibuprofen and similar medications, as these medications can be irritating to the stomach. Don't bathe in a tub or swim. No hot tubs or pools for the first 2 weeks. Incisions must be well healed before soaking in water. You may take sponge baths or showers. Incisions are closed with dissolvable stitches and supported with steri-strips. The area must be cleansed with soap and water in a daily shower. The steri-strips should stay on for 10 days after surgery and then may be gently removed in the shower. Schedule your first post-operative appointment at the same time you schedule your surgery. Your follow-up appointment will be 5 to 7 days from the day you are discharged from the hospital. You should call us if any of the following occur: shortness of breath or difficulty breathing, chest or shoulder pain, drainage from the incision, increased redness, increased swelling, increased discomfort, and elevated temperature. If you are unable to drink adequate amounts of fluids, symptoms of dehydration, such as dark urine, dry mouth, or lightheadedness. If you have a sense of fluids or foods getting stuck, leg pain or swelling, persistent vomiting or dry heaves,
New onset of reflux, or a night cough.
Well, that's it. Remember, we're here to provide you with all the support we can. So if you do have any questions, don't hesitate to call. I hope the results of your procedure will lead to a lifestyle that is rewarding and enjoyable, as it has been for me.